Welcome to Eye Contact. I'm Nino Hirnschall. I'm here with Professor Gerd Auffarth from Heidelberg, Germany. Thanks for being with us.
Yes, a pleasure.
Today I want to talk about how to quantify halos. So could you just tell us what is your experience with the difference of visual acuity and visual quality?
Yeah, that's a very important point. In former times we just measured visual acuity, and we actually only measured distance and near acuity. Even intermediate is a term that we haven't really used 10 or 20 years ago, and more focus gets on the quality of vision, and this includes a lot of other things: contrast sensitivity, but also photic phenomena, something like halo, like glare, flash, streaks. There are a lot of things that a patient can experience and that can interfere with his perceiving his vision.
So when you talk about all these phenomena, how do you quantify them? Or can you measure them in any way?
One thing, of course, is that you just quantify in terms of what is a percentage. How many patients complain or say they see something funny, let's say. But however, this cannot really quantify the intensity, the size, for example, of a halo. Halo and glare are the two things we really can quantify or measure, at least in a semi-quantitative way. Most of the time we need to show the patient some pictures where he can relate to and can say, this is how it looks to me.
And do you think, like, from an optical point of view and from the patient's perception, is there a big difference? Like, if you say, okay, this patient has like a little bit of halos and you quantify it, is it just also the way that the patient experiences it, or is it like very different?
It is still a semi-quantitative or almost a qualitative way to do that, because if the patient is not really happy with his vision, he may exaggerate the symptom. And this is one of the problems. It is not a problem if we compare different patient groups for comparative studies, so because this bias is in there.
Okay, understand. And when you quantify now all these phenomena, which kind of devices do you use? Is it like something common on the market, like everybody uses, or is it like...
That is one of the issues we have. We don't have like a ISO norm visual acuity chart for this. There are some programs on the market that have been used. Some have been introduced by companies, some have been used by individual researchers and then contributed to other colleagues. We use a halo glare simulator, which actually was written as a program in Bremen in a small company. The patient can see a night scene with cars, seeing headlights and backlights. And then he has the possibility to show on the screen how big of a halo, how intense a halo or a glare is. He can choose between different types of halos and glares, different forms, intensities. And with this, the patient gives a representative image of what he thinks he sees in the evening or when he drives a car. So there's a lot of subjectivity in it, but the interesting stuff is when we do that in a lot of patients and we compare different lenses, we see a difference. There's some other devices we currently use actually in a multi-center trial from an Indian group, a vision quality analyzer, where a patient also get pictures to see, and they are graded from 1 to 3 or 1 to 5. But it's a little bit more. It's not only halo glare, it's also haziness, blurriness, diplopia, a lot of other things are in there. And so this is a little bit broader approach to look at quality of vision.
And you talked about different lenses. Did you check different lenses, especially multifocal lenses, EDOF lenses?
Yeah,
and
that is actually the big question, which lens produces less photic phenomena. If you want to really look into that, you have to see what is normal, and nobody really knows what normal is. In our research group, the IVCSC net, we did a lot of testing with the halo glare simulator. Even normal persons without any eye disease, without any surgery, have been set in front of it. And even in 20, 30, 40-year-old people, they perceive halo glare occasionally. It may be due to the glasses, it may be due to the windshield, whatever. And if you compare that then with cataract patients before surgery, they have a lot of halo glare before. And if you then go to the intraocular lenses, we have to differentiate between monofocal, EDOF, multifocal of different near editions. And we really can see the differences. If I go into that in detail, I have to say that the monofocal lenses can produce up to 40-50% of patients a decent amount of halo glare. Individual cases even very severe. If you look at the EDOF lenses, we have, of course, to see that they have optical principles like diffractive lenses. They have more halo glare than aberration type of EDOF lenses, or low-ed lenses have less than high-ed lenses. The trifocals, it's quite interesting. You name it, Panoptics or Artemis 3, they're pretty much the same. Which, I mean, is understandable because there's not such a big difference in the amount of light distribution on the 3 different foci.
Just coming back to the normal population, like, do you have an age-dependent factor? You would expect halo and glare of this and that amount for a 20-year-old, for a 40-year-old, for a 60-year-old?
Especially the glare is also a retinal function, how to deal with the incoming light and how to adapt to that. And a younger patient have a much easier adaptation also if they change from light to dark or vice versa. So they are not such a big problem as glare for them, but the older you get, and this age group, let's say between 45-50, that is like kind of a turning point where you got more problems, especially also driving at night, and you can see that in these studies.
And do you think it's more an optical phenomenon of the lenses, or also tear film and all these issues?
It's a composition, especially in these non-treated or non-operated patients. We can see that dry eye or surface irregularities, and as I said, even a dirty glasses or contact lenses that have some protein on it and are moving, they can produce these side effects, and they are perceived as halo glare from the patients, or diplopia or blurriness in a way. So yes.
And maybe a last question, just there are so many multifocal lens studies on the market, and the question is just like, shouldn't we really quantify halos for all of these, and shouldn't we have like one device in the future that everybody uses, at least the same unit that we can? It
would be great if we have visual acuity testing with EDTS charts, some kind of glare halo representation that can really be compared with all these studies. I think societies like ESCRS or maybe the local national societies should really look into that, because it really has become an issue, and I think it's very important for our patients.
And thank you for watching. For more information on this and related topics, please visit us at eurotimes.org.